Hello, everyone, and we welcome you to this discussion on the theme Independence from Rabies. India bears the highest burden of global dog mediated human rabies deaths. This Independence Day, we are marching towards the eradication of the deadly rabies from India. Hence, this theme today. Rabies is one of the oldest recognized diseases affecting humans. The dog has been the main reservoir of the rabies virus in India. An infected individual becomes sensitive to touch and loud noise, develops a phobia of water, height, and bright lights, and undergoes hallucinations, paralytic attacks leading to coma and untimely death. This disease is rabies, a deadly viral disease that is 100% preventable. After the second wave of COVID 19, there has been a steep rise in animal bite cases across India. Normalization of activities like schools reopening, public activities, and daily workers resuming their work has led to a rise in cases majorly impacting children in urban and rural areas. Despite being 100% preventable, more than 20,000 people die of rabies in India every year. With uncontrolled stray dog populations, it is inevitable to control the animal bites. However, with right and complete WHO approved post exposure prophylaxis, lives can be saved. In today's discussion, we will be talking about the Viram, Full Stop on Rabies initiative by Zydus in partnership with Times Now, an effort to first reduce, then eradicate deaths from rabies by improving the usage of complete PEP. Collaborative efforts will be required from multiple stakeholders, including healthcare providers, veterinarians, public health officials, and legal authorities to make India a rabies free nation. To talk more on this topic, we have with us a panel of experts from across the country. Let's welcome Dr. D.H. Ashwath Narayana, Dr. Ravish H.S., Dr. Somu Sivabalan, and Dr. Murli Kumar V. All of them have been working dedicatedly over the years in raising awareness on rabies. I take this opportunity to welcome them and to introduce them to our audience. First of all, I would like to introduce Dr. D.H. Ashwath Narayana. He is currently the president of the Association of Prevention and Control of Rabies in India and professor and head of the Department of Community Medicine at Kempe Gowda Institute of Medical Sciences, Bangalore. Formerly, he served as the medical superintendent at KIMS Hospital and Research Center, Bangalore. In addition to that, he has been the project coordinator for WHO APCRI Indian Rabies Survey in 2017 and for a rural rabies prevention project sponsored by Global Alliance for Rabies Control and Rabies in Asia Foundation. He has published more than 50 articles on rabies in national and international journals and conducted more than 20 phase 2, 3, and 4 clinical trials with rabies vaccines, RIG, and monoclonal antibodies. He is the member expert group, National Guidelines for Rabies Prophylaxis 2019, National Center for Disease Control, Ministry of Health and Family Welfare, and the Government of India. We welcome you, sir. Next, I would like to introduce Dr. Ravish H.S. He's the Professor of Community Medicine, KIMS, Bangalore. Currently, he's the Treasurer at APCRI. He has been the mentor at WHO Epidemic Intelligence Services. He has an experience of more than 20 years in the field of rabies and has more than 60 publications in national and international peer-reviewed journals, few of which are quoted in WHO publications. He has been the investigator for WHO APCRI Indian Multicentric Survey 2018. He's also an active member of the organizing committee in many conferences, CMEs, and workshops across the country. He's awarded the Young Scientist Award by the Karnataka Association of Community Health in 2008 and Young Scientist Award by APCRI New Delhi in 2010. We welcome you, Dr. Ravish.
Thank you.
Next, I would like to welcome Dr. Somu Sivabalan. He is the consultant pediatrician and pulmonologist at Dr. Rela Institute and Medical Center, Sundaram Medical Foundation, Chennai. He has established Cystic Fibrosis Clinic for children at Kanchi Komakoti Child's Trust Hospital, a tertiary care teaching hospital at Chennai since 2014. He has been rewarded with many awards for his contributions in healthcare. Mentioning a few of them, he won Distinguished Alumni Award by Sri Devaraj URS Academy of Higher Education and Research, deemed to be university in 2022. He conferred Academic Excellence Award by Indian Medical Association, Tamil Nadu State Branch 2022. Awarded Fellowship of Asian Pacific Society of Respirology, Tokyo, Japan 2022. Also been awarded Dr. APJ Abdul Kalam Scientist Award by the World Tamil Classical University for the contribution to the society 2021. He further received the prestigious fellowship of the Indian Academy of Pediatrics by Indian Academy of Pediatrics and the Best Doctor Award by the Tamil Nadu Dr. MGR Medical University for exemplary contribution in the field of healthcare services 2012. He has published 62 articles in Index Journal and 29 chapters in textbooks. We welcome you, Dr. Somu. Next, I would like to welcome Dr. Murli Kumar V. He is currently positioned as the Chief of Casualty at Chinmaya Mission Hospital, Indranagar, Bangalore. For the past 26 years, handling emergencies and medico-legal cases and animal bite victims. He's also an APCRI member. He initiated the treatment of animal bite victims more than 26 years back and has also written a book on animal bite management, which is awaiting publication. He holds a special interest in educating the community on WHO guidelines in the management of animal bites and to be a part of the initiative of the Rabies Free India by 2030. We welcome you, Dr. Murli. So now let us begin the question answer session. Sir, Dr. Ashwath, my first question is for you. So we would like to know that India is the most impacted nation by the fatal disease rabies. Can you talk about what APCRI is and what function has APCRI played in progressing towards rabies-free India? And how much time will it take to achieve that?
Thank you for this important question. As all of us know, rabies is a very ancient disease known to mankind for more than, it is there for more than 4,000 years. And rabies is a very fatal disease, but it's a preventable disease. Across the world, there are more than 60,000 people dying of rabies. Out of that, almost one-third people die in India alone. Almost 20,000 deaths occur in our country. And since India has got a large number of stray dogs and almost equal number of pet dogs, an estimate around 25 million stray dogs are there in our country, and almost equal pet dogs. Because of this large number of stray dogs and pet dogs, we have a huge dog bite cases in the country. And according to the WHO APCRI survey, which we did in 2003, we estimated 20,000 human rabies deaths and 17.4 million animal bite cases. And now, the reports which are coming up now says there are even more number of dog bites, but human rabies cases would have come down. So in this regard, there is a burden study which APCR did in 2003-4, which is being quoted across the globe. And the recent one also, Government of India is doing with the help of ICMR, which is being done in 16 states. Already it has completed in a state of Tamil Nadu as of now, which we may get a new figure. Maybe by this year end or by next year, we may get a new figure of human rabies and animal bites also. With this huge problem of rabies in our country, the APCRI was started way back in 1998 with a vision to make India rabies free by 2020. And this organization has got, as of now, more than 950 members across the country, which has got both medical and veterinary doctors, and both from government as well as non-government sectors. And APCRI is involved in advocacy, research, as well as information dissemination across the country. And it also offers consultancy services for government, and is a technical partner in many of the Government of India and WHO studies. And in this relation, we did that very first WHO APCRI study, which gave that figure of 20,000, 70.4 million bites. That is a unique, which was done from first time in the country. Because earlier, Government of India or in the literature, there are about 30,000 deaths were quoted, and it was mainly taken from the epidemic disease hospital. This is the very first authenticated study from the community and also from all across the country. So after that, APCRI was instrumental in stopping a nerve tissue vaccine and starting intradermal rabies vaccination in the country by submitting a memorandum to the then Union Health Minister, Mr. Shatrugna Singh Ji, in 2006. So following that, the Government of India started the intradermal rabies vaccination in entire country, one state by another state. So now in most of the states, the intradermal rabies vaccination is being given, which is accepted as a very cost-effective method of providing a post-exposure treatment. Another important function of APCRI, through its members across the states, we are creating a lot of awareness program. We are creating awareness both among public as well as professionals. So APCRI is involved in a lot of training programs, continued medical education programs, continued veterinary education programs, the symposia, seminars. So APCRI has conducted so far 21 national conferences in different parts of the country. It's mainly to share the information as far as the research going on in the country and from other countries. And we invited eminent speakers from WHO, CRO, from Government of India, and the premier institutions like Pasteur Institute, Central Research Institute, Kasoli, and both from government and veterinary sectors. We also have two important WHO collaborating centers in the country. One is a NCDC, National Center for Disease Control, Delhi, and we have at NIMHANS for WHO Collaborating Center for Reference and Research on Rabies. So apart from that, APCRI also is in working closely relation with OE Reference Laboratory at Veterinary College, Bangalore, who are developed a unique technique for diagnosis of rabies in animals. So APCRI is involved mainly in these research activities and advocacy, and even creating awareness both among public and professionals. And in 2016-17, we did another study across the country on a programmatic experiences of rabies for GAVI, Global Alliance for Vaccines and Immunization, with the help of financial and technical support from WHO. We did that study in 2016-17, and those information, the results have been published, and it has been submitted to WHO. Apart from that, APCR has also conducted a lot of training programs and also developed educational materials. Like we have developed a video for education of school children. So APCR, in summary, is involved in creating awareness. It's supporting, I've done a lot of research work and also information dissemination, so that we could able to reduce the burden of rabies in this country. And in December 2015, WHO, with the help of Food and Agriculture Organization and OE, World Organization for Animals, have come up with a resolution of eliminating dog-mediated human rabies by 2030. So we have about 8 years time, And we have to make use this very important 8 years time to work towards making this country zero by 2030. So recently, government of India has published, come out with a national action plan for rabies elimination, and also requested all the state governments to notify rabies as a notifiable disease. So APCRI, through its members across the state, is submitting memorandum to all the state governments to make rabies notifiable disease, and also to implement state action plans for rabies elimination. So this is in short what are the activities, the functions of APCRI, and we hope that we could able to collaborate and coordinate with all the government and non-government organizations working for rabies in the country to make or eliminate dog-mediated human rabies by 2030.
Thank you so much, Dr. Ashwath. I am sure with all these initiatives and efforts, we'll be able to achieve a rabies free India by 2030. Now, with that, I would like to move on to Dr. Ravish now. Dr. Ravish, my question to you is, what is rabies and how does rabies virus gets transmitted to humans? And what
Rabies,
happens? Yeah, please continue.
rabies is a neglected zoonotic disease. As told by the previous speaker, it is a fatal disease, but it can be 100% preventable. It is caused by exposure or bite of infected animals. In more than 99% of the cases in our country, the virus is transmitted through bites of either dogs or cats. Even other animals like domesticated animals, wild animals, and any other animal can transmit rabies to humans. The virus enters through transdermal inoculation, that is, wounds after bite or scratch, or by direct contact of saliva of mucous membrane, or through skin lesions if it is directly exposed. It affects the central nervous system, resulting in encephalomyelitis that causes fatal disease in humans. The virus initially infects the host at the periphery, wherever the bite is there, and the virus is deposited through the saliva of the animals, enters the motor neurons or sensory nerves, and moves to the central nervous system. And later, at the later stages, there is also centrifugal spread to major exit portals such as salivary glands. That's how the virus will be there in the saliva of the biting animal if it is infected. Coming to the problem rabies and its symptoms, the initial symptoms may occur within a few days after the bite. It may vary from few days to few months. However, in majority of the cases, it will appear only after few weeks. Initial symptoms will be headache, fever, fatigue, muscle spasms, agitation, and aggressiveness. And later, the classical sign of human rabies is hydrophobia, that is, fear of water, which comprises inspiratory muscle spasm, painful laryngospasm, and fear of water itself. And also later it may follow with aerophobia, where the patient will be fear of air as well as light. So this is in brief regarding how the disease spreads from animal to humans, what is the pathology and what are the symptoms if anybody gets rabies. Thank you.
Right. Thank you so much. Another question to you only, sir. What are the different categories of exposure to rabies virus and how to identify category 3 rabies virus exposure? Also, can pet animal bite cause rabies?
Yeah, exposure with a suspected rabid animal can be divided into three categories as per the World Health Organization, which is also approved by our NCDC New Delhi, that is the Government of India. There are three categories. Category 1 includes touching or feeding of animals, licks on intact skin. That means there is no exposure, since all of us know that skin is a perfect barrier to most of the microorganisms. If the skin is intact, there is lick on the skin. If you want to pet your animals, nothing will happen. So it is category 1 bite. So there is no issue, no clear exposure is there for any rabies virus if it is also there in the animal saliva. Then is category 2, nibbling of uncovered skin, minor scratches or abrasions without bleeding. If there are minor scratches when you're playing with the dog or cat, there are minor scratches will be there. If it is without bleeding, then it is category 2. In category 3 consists of single or multiple transdermal bites or scratches, licks on broken skin. If there is an injury, if there is a wound, if there is licks on that skin, then there are chances of directly virus entering into the wound. That's why it is category 3. And contamination of mucous membrane with saliva from licks. In general, any site of blood, even a small drop of blood or to a very large wound, whatever it is considered as category 3 exposure. Any wound with bleeding is category 3 exposure. And as all of you know that most of the times it is only the category 3 exposure which will come up to the hospitals. Many times only in cities minor scratches and other things will come to the hospital. Especially at the rural levels, it is 90% of the times it is category 3 exposures only. So this is in brief regarding the categorization of animal bite wounds, depending upon which the post-exposure prophylaxis has to be provided. Then coming to your other question regarding pet animal cases, pet animals can also transmit the disease. And of course, as all of you know, although unvaccinated animals are more likely to transmit the disease, the pet animals who are vaccinated also can do so because of improper or ineffective vaccination. There may be 3 reasons. One is improper administration of vaccine or poor quality of the vaccine. You know the quality of the vaccine sometimes. And poor health status of the animal itself. And third one vaccine does not provide lifelong immunity for the animals. It has to be annual. Every year, the pet dog has to be vaccinated. Therefore, we have to know that if we do vaccination for pet animals or stray animals, it is to protect the animals, not the human beings. Therefore, we have to consider those exposure as either category 1, 2, or 3, and we are supposed to give post-exposure prophylaxis accordingly to prevent rabies, since rabies is an 100% preventable disease, and we have the rabies immunobiologicals in our country. So we have to prevent the disease and eliminate the disease by 2030. It is possible. Thank you.
Thank you so much, Dr. Ravish. Now that we have understood what rabies is and how is the virus transmitted to humans, and also the minute details that you have shared about taking care of the pet animals, getting them vaccinated, I would now like to move on to Dr. Somu Sivabalanji. Dr. Somu, my question to you is there any treatment available once one is infected with rabies virus?
Okay. Supposing to the part one question, supposing if the child or the human is being affected with rabies, it means the rabies virus has already reached the brain and already started causing symptoms. So if it is a symptomatic case, then there is no cure. 100% fatality is assured. So the only way this happens is by reaching the brain. So it doesn't happen overnight. So there has to be a bite, as said before. It is either through the skin or the mucous membrane, then it has to enter through your nerves, then it has to travel and then reach your brain. So there is always a time gap, and the gap can vary anywhere between 5 days to few months to few years too. So it also depends on the severity and the degree of bite. Irrespective of whatever, there is a time lag, so that has to be capitalized in prevention. The prevention, depending on the category of wound, as rightly pointed out by Dr. Ravish, if it is category 1, no deal, nothing to be done. If it is category 2, meaning there has been a breach in the skin, but there is no bleed, this cannot be ignored, saying it as a simple scratch. It has to be vaccinated with the vaccine in a 4-dose schedule, 0, 3, 7, and anywhere between 14 to 28 days. So 4-dose schedule. And if it is category 3, it has to be vaccinated with the vaccine in the same schedule, along with, because of the mucous membrane getting involved, along with the blood oozing being there. It is considered to be much deeper, and the chance of penetration and reaching the brain is much faster. So you have to immediately neutralize the viral load by giving something called the passive immunization or immediate protection in the form of immunoglobulins. Now monoclonal and polyclonal antibodies are available. So these things have to be done. So that is important. More than these two, first and foremost is strict and good washing in a free flow water with soap, preferably in a running tap water at least for 15 minutes. If it is washed, the load and the chunk of the viral load, which has been in the site of inoculation, is being negated. After which is your passive immunity, so which tries to neutralize the local viruses and from preventing further. Then, as time goes by, the active immunization of your vaccine kicks in, which your body produces antibody against and gives you a longer immunity when protecting against rabies. And I am a pediatrician, and though everybody keeps talking about dog bite vaccine, it is most of the time right. But that name itself sounds to be a misnomer because the moment you say dog bite, they think it is only by dog and it is only by bite. In pediatrics, what happens is kids most of the time with stray dogs and other things when they play, lot of scratch marks keep happening and people don't bother about that. They come to your clinic saying the child is not eating, talk to you for 15 and 30 minutes. At the fag end, before they leave the door, they call doctor. By the time, way I forgot to tell you, he also had a scratch by a dog, but it is nothing much to worry, no. It will be a passing remark. So you have to tell them this is something to be worried about and something to be addressed. So that, and lot of people are having kittens and all sort of cats as pet, and they are also equally vulnerable in producing rabies. So that is one. The other thing they say is pet dog and vaccinated dog, as Dr. Ravish has already said, despite the dog getting vaccinated, we have to immunize to protect ourselves. We can't take a chance in these things. And the other thing is they say it's a friendly dog, it is to play in the park. Today, all of a sudden, it bit. So it doesn't mean the dog has to be ferocious always. It has to be a bigger dog or a wider dog. Any dog bite, it is only the animal that matters. And they always say it is a small puppy and it does no harm. It is not that. It is the animal that matters. So you have to know. You might know that to be the friend, but the virus doesn't know it's a friend. So that has to be taken into consideration too. The other important thing is most of the time they say when we say you have to give two sorts of vaccine, they say they give tt. Giving tt is not a problem, but tt alone will not fix your problem. So they will say minor scratch, tt is enough. So that's what even with practitioners it happens. So that has to be looked into. And most of the time they vaccinate but don't give passive immunization for grade 3 wounds. And in South, there is a general belief saying that when you take a vaccine, you have to be in all sort of dietary restrictions. So that also adds on to the confusion. And that is not. When you take a vaccine, you can live your routine day-to-day life. And the other thing is, previously people used to say 21 injections around your umbilicus. That's what they all fear about. The moment you say dog vaccine, they think that it will be poked everywhere around the umbilicus, and people are also scared to say. With regards to pediatric, people are used to vaccines and the parents are used to vaccines. When it comes to rabies vaccine, they have a lot of restrictions because they think minor scratches and licks are not a problem. So that also has to be emphasized. And they ignore the other bites like your cats and things like that. That also has to be educated. They think smaller the animal, less prone for rabies. So that has to be educated. So these are the common things which we see in clinical practice.
Right. So basically, ignorance is something that we have to avoid now. We have to be more aware and take it seriously. That's what people are not aware, so they don't take it seriously. And thank you so much, Dr. Somu. Another question that I have for you only is that are vaccines not alone sufficient for management?
No, vaccines are good, but it is not like a watchman. The moment you employ him, he takes over the duty. So vaccines have to induce immunity in you, and the body has to mount up an antibody response. So that is going to take a bit of time. they usually say 2 weeks. It can anywhere be at least 7 to 10 days for a vaccine to kickstart action in you. Whereas with regards to passive immunity, especially with grade 3, category 3, in category 2, you need not have a passive immunization. In category 3, you need to give passive immunization. And reports of the rabies getting manifested as early as 5 days are also been there. So the crucial time, still the vaccine starts to act, you cannot wait. That's why passive immunity to load neutralize the viral load in that particular area, because the passive immunity or the antibody or the monoclonal antibodies are being infiltrated around the bite wound just to neutralize the local viral load in that particular area. Vaccines alone might not be 100% protective with regards to category 3 wound. If it is going to be a category 3 wound, the severity and risk of you developing a rabies is much higher. So, in such circumstances, rather than waiting for the vaccine alone to kickstart action, you need to be preemptive in preventing even the time gap in between by giving passive immunization with an antibody or a polyclonal antibody, so that that will ensure 100% protection with category 3 wounds. So that is the main
Right.
message. If there is going to be a blood oozing, or if there is a mucosal contact with the saliva, that also has to be taken into account. Usually, all these rabies pictures, the moment you see it, will be a ferocious dog with the teeth being shown this way. Everybody thinks it's the teeth that is the culprit. Teeth has a toxin in it. Teeth does nothing. Teeth is just a facilitator for your saliva to get into the bite site. So the saliva contains your viruses. So it's a virus within the saliva that is the problem. Then people might ask, why scratch mark is a problem? The saliva is not there in the nails. Usually, the dogs and all the animals keep fidgeting around the mouth and also keep licking their paw and also the nails. So the saliva is getting stagnated there in the nails. So when you scratch, the chance of that getting impregnated in your skin is much higher. So that's how the rabies is transmitted, and it is not through the teeth of the dog. That is one thing important. So it is animal and the category of the bite that has to be taken into consideration, and not how and when and where and what the vaccination status of that particular animal. Thank you.
Right. So vaccine is just a part of it. There is a whole picture that we have to take care of. We have to be aware and not take anything regarding our pets lightly in order to be safe from rabies. Thank you so much, Dr. Somu, that enlightened us so much about it. Dr. Murli, my question to you is,
Yes, madam.
what is the way forward to ensure usage of complete PEP, including the use of vaccines and ready-made antibodies?
Yes, madam. The thing is, whenever there is a case of category 3 bite comes, we treat them with TT, vaccines, and immunoglobulins, as said by the other speakers. Now, when it comes to these things, many people don't take immunoglobulins because of the cost factor and all those things. Most important factor when we have to use in post-exposure prophylaxis of TT, vaccine, and immunoglobulins is awareness among people is most important, which you're all doing. We are very thankful to you. The other important factors which we have to consider whenever we choose a product for passive immunization is, one is the safety of the product. Whenever it comes to vaccines and we want to inject something into a person, first thing comes is safety. When whether they are rich or poor, first they want safety. One is safety. Second one will be the availability. See, if you see in rural areas, most of the time vaccines and immunoglobulins are not available. When it is not available, they don't take it. That is also one more reason. The third reason is efficacy. What is efficacy means, whenever we give any molecule, any vaccine to it, it should be efficacious. Otherwise, it leads to failure. And the fourth thing is affordability. When all these things are there, affordability is also important, because India is not a very rich country. So whenever people, whether they are rich or poor, they buy something, they always think about the cost. So affordability becomes a very important thing. Now, first thing, if you see about safety, the cocktail monoclonal antibodies which are recently come into the market is a boon to our Indian community, because earlier we had horse serum and we had human serum. Horse serum required test dose because some people had reactions. And so when people are worried about whenever we tell reaction means they are worried that something will happen. So as a result, when you come to this monoclonal antibodies, which are recently produced by major companies, what happens is they give complete protection with there is no test dose required in them. So when we tell no test dose, there is a safety factor. So many people go for it. That is one thing. And the thing is cost and affordability. If you see, the horse serum is very economical, but the problem is when we tell the patient requires a test dose, they don't take it because they think that after taking this, even though it is cheap, they may get reactions. And the treatment, if they develop anaphylaxis, the treatment cost becomes much more. That is one. Secondly, the monoclonal antibodies which has come into the market recently are very safe and they are very economical because if you see the cost of it, the cost is one-fourth the cost of human rabies immunoglobulin. Human rabies immunoglobulin is derived from human serum, which becomes very difficult. Now, with this COVID season, getting a donor who is very safe from any of these infections is very difficult, and getting that becomes a problem. So, the cost factor is the second thing. Availability. See, availability, if you see, in my practice, I have seen that many a times there were shortage of vaccines which my patients used to occur because we have to get the horse serum or human serum either from animals or humans. But if they're not available, what happens is it becomes difficult. For example, if you rear the animals only for vaccine protection, sometimes we have an opposition from the animal activists. Okay, so as a result, we will not be able to use these animals for it. And when it comes to humans, we don't get healthy individuals to get it, so it becomes a difficulty. As a result, we may not have the availability. That is one thing. And the third thing is this recent passive immunization, that is the immunoglobulins which are available, have very high potency. That means at the bite sites, once we inject, because these immunoglobulins are to be given at the bite site, maximum infiltration at the bite site, and remaining to be given intramuscular. But how much that will help is still debatable. But it covers how much ever viral load is there, it kills that virus at that bite site. And this is developed by a technology called as hybridoma technology, hence ensuring that we don't rear any animals or humans for the sake of these immunoglobulins. Then WHO has recommended using a cocktail of rabies monoclonal antibodies as a replacement to rabies immunoglobulin. This RMABs which are there are very safe. It is highly efficacious and it is alternate to equine rabies immunoglobulin and human rabies immunoglobulin. It can be produced at large scale and where there is a standard quality and which is free of any adverse reaction. You can use it in humans, and at the same time, what happens is we don't have to search for animals to rear them to get the immunoglobulins. So this is one advantage. And according to the new WHO recommendations, use of RIG and RMAPs at the bite site maximum if we give there, and avoid IM or IV instead of giving it intramuscular, we can save the dose that is required for passive immunization. This is what is the guidelines, and we would like to stick to it so that many more people who have been left over for affordability of the cost, we can bring them into the circle so that we maximum people are being vaccinated for it and they are protected from rabies.
Right. Thank you so much, Dr. Murli. That means that this novel option that we have is cocktail of monoclonal antibodies. It can benefit the public at large and help in achieving the global mission of zero death by 2030. That's right. So
Yes,
it
ma'am.
seems
Yes.
like a beam of light for all of us. So
Yes, ma'am.
now, thank you so much. I would like to thank all the doctors for answering all the questions, all the necessary questions related to rabies. Now we have certain questions coming in the comment box. I would like to ask each of you one by one some questions. So my first question is for you, Dr. Ashwath. Can I, somebody has asked in the comment section, can I get rabies in any way other than an animal bite?
Uh, Most common is only by the scratches or the bites of by animals. Uh, very rarely, uh, and it's not documented, but theoretically possibility is there. Theoretic possibility from organ transplantation. Organ transplantation is one, and contact with the hydrophobia case. That's another one, and apart from these two, there are minor exposures, maybe like aerosol in the caves, maybe a possibility. So these are the three possibilities apart from the bites from animals, where one can get rabies.
Right. Thank you so much, Dr. Ashwath. That was very informative there. Now, I would like to move to Dr. Ravish. Dr. Ravish, another question that is coming in is rabies always fatal?
Yes, madam. If it is not prevented by early and correct or complete post-exposure prophylaxis, it is always fatal. Therefore, it is a must to provide post-exposure prophylaxis, which has already been told.
Right. And how soon after an exposure should I seek medical attention is another question coming in. Dr. Ravish, if you can only answer this question.
I will answer. As early as possible is the best, because as I've already told you in the beginning, the virus, once if it is deposited over the surface of the wound, especially the bleeding wounds, they can be absorbed through the nerves. Therefore, as early as possible, if you can infiltrate all the wounds, 1, 2, 3, or whatever the wounds it is, with rabies immunoglobulins or rabies monoclonal antibodies, which are ready-made antibodies which will neutralize the virus at the site of deposition, then there is no chance of rabies. 100% protection will be there. As Dr. Shivabalan has already told you, vaccine will protect after 1 week or 10 days once you start the course of vaccination. Therefore, earlier the better. It's always better. But nevertheless, if it is late also, since the incubation period of the disease varies from few days to few months, even the patient comes after 1 week or 1 month, if he tells where is the bite site and if there was bleeding, you can still go ahead with infiltration of rabies immunoglobulins or rabies monoclonal antibodies along with the full course of anti-rabies vaccination. If it is intramuscular, 5 doses. If it is intradermal, it is 4 doses as per our NCDC guidelines. So therefore, we should not neglect any of the bite cases. Earliest is the best, and whatever the time he comes, we will not neglect them. We have to give complete post-exposure prophylaxis to prevent the disease.
Right. In short, as soon as possible, we should get the medical attention. Thank you so much, Dr. Ravish. Now, Dr. Somu, I would like to direct the next question to you. Why wound washing is important is another question coming in.
See, any contamination by a bite or anything, washing is the best. Meaning the major load of the viruses is being washed off, which is superficially there. Whatever has been left as a residue is being washed off. So initially, what happens is most of the time when there is going to be a bite in the rural places, they put mud, they close it off, and that is not to be done. Otherwise, tincture or some iodine they apply, that should not be done. And when there is going to be bleed, immediately they bandaged it off instead of washing. That should not be done. Irrespective of whatever be the thing, wash, and make it clean as much as possible. Preferably in a clean running tap water with soap. Without soap, at least a clean running tap water. If not done immediately, at least less than 3 hours, continue doing it. And in addition to what Dr. Ravish said, vaccination anytime when you come in contact with a history, but with regards to the immunoglobulin, till as much as 7 days. After 7 days, it has not been recommended to be given in category 3 wound. That is one. And people also always ask a question, if the dog is alive for 10 days, then it means it's not rabies. Can I wait for 10 days and then take a vaccine? If the dog dies at 10 days or within 10 days, then the risk of you getting is much higher and the golden time is already lost. And the stress and anxiety you go through is there for life. You don't know whether after many years you will again get it or not. So when in doubt, if there is an animal bite of a stipulated category, take according treatment. And washing is the best even before giving your antibody and the vaccine. Before you get to the medical attention, wash and then get to medical attention.
Right. And in continuation to that, there is another question. So, Dr. Somu, if you could only answer this one too. Is there any home remedy available for managing the wound?
What home remedy? It's only washing. Don't put turmeric, don't put native medicine, no neem, no local bandages. Keep the wound exposed, keep it open. That is a as much as possible. We don't even suture because the chance of that infiltrating deeper in is higher. Only in select situation they do suturing. Otherwise, they do the so-called secondary suturing after a few days. So, as much as possible, don't try to manipulate. Just wash, make the surface clean, and get to medical attention. No home
All
remedies is advised in this scenario.
okay, so no home remedies other than washing the wound and going to the doctor. Right. I hope that clarifies the answer. Now, that clarifies the question for our audience. Now, next question is for Dr. Ashwath. I would like to direct the question to you. The question is, my pet dog's vaccination is up to date. Should I seek PEP in case of a bite?
This has been answered by Dr. Ravish earlier. This vaccination of pets should be done regularly as per the recommendations of the experts, veterinarians. It is first dose of vaccination at around 1.5 months, and again one more dose need to be given after a 1 month interval, and annual vaccinations. So this has to be done, but this is not practiced by many of the pet owners. So, in all these cases, when in doubt, you have to vaccinate, because this vaccination of pets is mainly to prevent rabies in animals, and sometimes it may not able to prevent spread of rabies, transmission of rabies to human beings. So, whenever even with a pet dog bite with a vaccination, then it is better to start post exposure prophylaxis in the human beings. So the general dictum is better to over-treat than under-treat in rabies, since rabies is 100% fatal.
Right. Thank you so much, Dr. Ashwath, for that answer. I hope the audience now understands that. Now, moving on to the next question that we have, I would like to request Dr. Murli to answer this question. Dr. Murli, the question is, if I missed visiting the doctor after an animal bite for a month, what should be done?
Most important is documentation, madam. What happens, as Dr. Ravish was telling, uh, he may come after 1 month, but we consider that he is in the incubation period and start him as a case. He points out the place where there is a bite and we see a mark, we can treat him still. But the problem comes is we are not guaranteeing that he will be completely free of rabies, because if 2 3 days prior to that itself the incubation had ended and he is going to get a disease, a treatment will be given, but when there is no guarantee, documentation becomes very important. This I have seen in many cases where many of the doctors, if their friends or relatives come, they don't document. If they don't document and by chance they get rabies at a later stage, nobody will protect us because the court wants evidence. And until you document, it becomes very difficult. That's why we tell doctors, whether it's a clinic or a hospital, please keep a document of what has happened, because as said, you should get treated as soon as you are bitten by an animal. So if they come to you after 1 month, you have treated, tomorrow they will tell the person went to a doctor for treatment, but they don't tell when he has gone for treatment. If they have gone late, it amounts to contributory negligence from the patient side. But if the doctor has not treated in time or not advised the immunoglobulins and vaccines in PEP, that time it amounts to medical negligence. So here we should be careful about medical negligence and not contributory negligence. He has come late, you document it, but you treat him. You are not at fault. But your patient comes to you, you don't advise him, and he doesn't take the injection. That time, what happens is you are at fault and it amounts to medical negligence. If a doctor documents and tells these are the complete schedule, that is TT, vaccine, immunoglobulin, and supportive therapy, he has written there, and the patient refuses to take anything, you are not at fault. But if you have not advised at all, you are at fault and you can be booked under medical negligence.
Right. Thank you so much. So, documentation is the key here that we
Yes,
should
ma'am.
take care of. Right. Thank
Yes.
you so much, Dr. Somu. Now, I would like to move to Dr. Ravish. Ravish, the next question is, what if I miss the anti-rabies vaccination schedule?
Anti-rabies schedule or vaccination schedule is of two types. One is intramuscular route of vaccination. It consists of 5 doses of vaccine as recommended by Government of India NCDC guidelines as on today. It is on day 0, day 3, day 7, day 14 and day 28. All 5 doses is a must for complete post-exposure prophylaxis even after taking rabies immunoglobulins. Then another one is that is called as SM regimen. Another one is intradermal schedule, where intradermal rabies vaccination is given. It consists of 4 doses. Each dose consists of zero point 0.1 ml into the skin in two different regions, that is on two different deltoids on day 0, day 3, day 7, and day 28. There is no day 14 here in intradermal route of rabies vaccination. It is called as updated thyroid cross regimen. These are the only regimens which are recommended in our country by NCDC, Government of India.
Right. So thank you so much for that. That highlights the points, the key points that we need to take care of. Now, next, I would like to go to Dr. Murli. Dr. Murli, my next question to you is from the audience, of course, is what happens if the doctor does not advise about the importance of immunoglobulins in category 3 animal bites?
It amounts to medical negligence, madam, because the court tomorrow will tell patient is uneducated. He doesn't know anything about animal bites. You have done medicine. You should know about it. Patient doesn't know. A patient has come to a doctor for an advice. It is our duty to make him aware of what it is and see that he completely understands what it is, and you should advise. It is our duty. That's why whenever I treat my patient, I take at least 15 minutes to half an hour to educate the patient on what I am giving, and each and everything given to a patient will be clearly explained and his signature taken in case he refuses it.
Right. Now, I would like to go to Dr. Ashwath. Dr. Ashwath, the question that I have received is, if a previously immunized person is bitten by a rabid dog again, what is the re-exposure vaccination schedule?
Yeah, in this case, we need to provide only 2 doses of vaccine on day 0 and 3. If it is given intradermal, it is only 0.1 ml on one single site on day 0 and 3. So only 2 doses of vaccine. But when this previous vaccination, either pre-exposure or post-exposure, which are they are taken, are not well documented. It is just oral, and if the present bite is very severe that too with a history of a probable or a confirmed rabid dog, in addition we also give immunoglobulin or rabies monoclonal antibodies into the wounds. So we don't just stop at giving 2 doses of vaccine, but we also give the immunoglobulin and monoclonal antibodies. But if very well documented pre and post exposure prophylaxis, then if the present exposure is mild to moderate, then we give only 0 and 3 day vaccine on day 0 and 3.
Right. Thank you so much, Dr. Ashwath. Now, the next question is for Dr. Ravish. Dr. Ravish, the audience wants to know that how monoclonal antibodies are better than immunoglobulins for passive immunization.
But monoclonal antibodies are developed in the laboratories. So usually it will be free from all the side effects. And it can also be improved upon. That means to say the production facilities can be easily upgraded to whatever the requirement it is. As Murali sir was telling, there was a lot of shortages. Even previously also we have seen many times. So these shortages can be overcome by these monoclonal antibodies.
Right. Thank you so much, Dr. Ravish. Now, my next question is for Dr. Somu. Another question that has come in, sir, is can the milk from a rabid cow cause rabies?
No, it is not. It is not proven to be so. It is only through the secretions like saliva, but milk. I am not sure. It has not been documented. I am not clear on that.
Okay. Okay, so it is not documented, so there's no clarity on that. Thank you so much, Dr. Somu. My next question is for Dr. Murli.
Yeah, yeah.
Dr.
Dr.
Murli,
Ravish wants to.
Yes.
okay, Dr. Ravish. Yes, Dr. Ravish, please answer.
As per the present guidelines of WHO Technical Report Series 1012, cow's milk is not shown to be transmitting the disease and it is not documented anywhere in the world. So, as on date, there is not needed.
Right, right. Okay. Thank you so much, Dr. Ravish and Dr. Somu, for highlighting that. Now, my next question is for Dr. Murli. I come to you with the question, Dr. Murli. The
Yes, ma'am.
question that has been asked is, what is the importance of documentation in case of animal bite treatment?
Yes, there are two reasons which is important, madam. As Dr. Ashwat Narayan sir was telling, that it becomes a notifiable disease. So, see, every day in the hospital, I get around 8 to 10 cases of animal bites. I have to document and send these reports to BBMP through my medical records. If so, the thing is, action can be taken. That is for one reason. Second reason is, many a times what happens is the patient comes to us and he tells that he has taken this treatment previously. So, if that's what, in case of re-exposures, if they don't have documentation, and in that case, we just give vaccines and the person gets rabies. So, we are held responsible. So for that purpose, it is there. And the third thing is documentation plays a very important part in the development of the state and nation also. Just to know what is the amount of animal bites which are occurring in different areas. Secondly is how is that the government can take action to see that they improve on those areas to control. One is the stray animal population or the production of immunoglobulins and vaccines which are required, circulation and availability, and how they can do these things to get it at an affordable cost. So for all these factors, documentation becomes very important. And at the same time, many a times there are publications which are there. Even for publications, we should know what is the number of bites which are there. So how many patients are treated at different places, and are we improving the standard of treatment, and are we bringing down the number of cases which are there, are we giving the best treatment to the patients, and are we able to bring down the rabies cases and bring it to zero by 2030? This is the importance, madam.
Okay, sir. All right. My next question is for Dr. Ravish now. The question is, what if I miss giving the passive immunization and patient comes after 10 days? Should I give passive immunization?
Yes, ma'am. Passive immunization is very important. As I've already told you, they are the ready-made anti-rabies antibodies, which has to be infiltrated into all the wounds, especially those wounds which have blood or bleeding is there. Because to neutralize the virus at the site of deposition, as all of us know that it is the virus will be there in the saliva and the saliva will be deposited in the wounds. So to neutralize the virus, we have to give rabies immunoglobulin as early as possible. And if the patient comes later, 10 days or 1 month or whatever it is, if the patient has started anti-rabies vaccination, it usually takes 7 days to 10 days to produce active antibody response in the body of the patients themselves. So, if the patient has taken 3 doses, as I've already told you, 0, 3, 7 will be the first three doses of vaccine. The antibodies would have developed by 10 days. So, if the patient has taken anti-rabies vaccination 10 days prior, then there is no need for rabies immunoglobulin or rabies monoclonal antibodies. If the patient has not started with anti-rabies vaccine, we have to think that the virus is still dormant at the site of deposition, that is in the wound. Whether it is 10 days or 15 days or 1 month, we have to give rabies immunoglobulin along with anti-rabies vaccine, full course. So that is the importance of rabies immunoglobulins or rabies monoclonal antibodies. Am I clear?
Yes, sir. Yes, sir. Thank you so much for that very clear answer, in fact. Now, for the next question, I would like to ask Dr. Somu. Dr. Somu, the question that we have received is, what if the patient has been given a vaccine at another clinic and the patient has missed the follow-up? I give passive immunization on day 12. Should I revaccinate as per schedule from day 0, or should I continue the vaccination?
As in any vaccination schedule, you need not restart the vaccination. You can continue with the schedule, and that day, particular day, you can consider to be the third dose or whatever, the second dose, and complete the schedule. There is
Right.
no, we need not reinvent the wheel. We can as well continue and finish off the schedule.
All
The
right.
remaining leftover doses.
Okay, so no restarting it, just continuing with the flow. That answers the question. Thank you so much, Dr. Somu. And for the final question, I would like to go to Dr. Ashwath. Dr. Ashwath, I would like to ask you, can the rabies vaccine and immunoglobulin be given to a pregnant woman or a lactating mother?
There is some evidence in favor of this with some vaccines only, but these studies have not been done for some of the vaccines which has been recently introduced, including monoclonal antibodies. But this can be studied not in the only in the after these products have been marketed, what we called as the post-marketing surveillance. So since rabies is 100% fatal, there is no contraindications for using this one. So we have to you give both vaccine and immunoglobulin, whatever the vaccines and immunoglobulin available at that place or at that hospital. And it is when you have this risk versus benefit, definitely you can give available vaccine and immunoglobulin to the pregnant woman. You can give it.
Right. Right. So if we measure the risk as well as the benefit in two sides, then we should give it. Right. Thank you so much for answering that, Dr. Ashwath. Now, I would like to thank all of you once again, Dr. D.H. Ashwath Narayan, Dr. Ravish H.S., Dr. Somu Sivabalan, and Dr. Murli Kumar V. Thank you so much for answering all these questions. It was a pleasure to have you all with us. So, thank you so much once again.
Thank you.